WIC, Breastfeeding Peer in Ohio, Nurse Family Partnership, awesome, United Healthcare, great. Mercy Health, Resource Mothers Program, cool. Ohio College of Medicine, Government Resource Center, very interesting, thanks all. All right, I have 8 o'clock my time, 9 o'clock your time. Welcome everybody. Good morning. My name is Megan Ockett. I am the Associate Director of Programs with Count the Kicks. Just want to double check, I am recording this. We have a full house today, over 100 people registered, so I'm sure we'll have a lot of people join as we get going, but we have a lot of great information to cover today. I'm so excited to be talking to you today. Go ahead and use the chat box to put in where you're from, what organization you represent. And so I'm going to go ahead and get started. Let me get going here. So if you didn't know, this is where you're at today. This is the Count the Kicks, Save Babies with Us, a healthcare provider's guide to talking to expectant parents about fetal monitoring. So we have a great group of presenters today. We have Melissa. She is the public health consultant at ODH. She is my main contact. And then we have Carrie Davis. She is an Ohio ambassador with Count the Kicks, and she will share towards the end of the presentation a little bit more about our ambassador program and her personal story. And then, of course, that's me. I'm the Associate Director of Programs at Healthy Birthday. My contact information is there. Feel free to reach out to me. I love hearing from people. I love hearing from people in the community and learning what you're doing to help save babies and how you're implementing Count the Kicks, and any feedback or thoughts you have. Really briefly, a little bit more about me. I have been with Healthy Birthday for just over a year. Prior to that, I worked for Iowa Department of Public Health, and I was actually doing tobacco control and prevention for about 11 years. Over the past couple years, my focus really shifted to maternal health and worked on the Quitline, Iowa contract and cessation for pregnant women. And so I have 3 children of my own. I have used Count the Kicks, the app with 2 of them. My oldest was, the app was not out when he was born in 2013. It came out in 2015. And so I'm just very passionate about prevention and education. And so what I do at Healthy Birthday is I work with our state partners like Melissa, ODH, with our contracts in all of our other states. And then I also write the grants. I do a lot of the disparities work, and I also work on our app and website. So any sort of programming type initiatives you can think of is what I do. And so just really quick, a couple of housekeeping things as people continue to join. Like I said, we had over 100 people register for this, so this is awesome. This will be recorded, or is being recorded. And so after the presentation, probably later today or tomorrow, you will get an email with the recording, with the PDF of the slides, and then a survey. We would love to get your feedback, love to hear from you. So be looking for that in your inbox. If you haven't gotten it by the end of the week, feel free to shoot me or Melissa an email. Her contact information's there. One other housekeeping thing, I am working from home today. If there's an internet issue or anything like that, just stay on the line and I'll hop on my hotspot, but we should be good to go. And with that, I'm gonna quickly turn it over to Melissa to say a few words.
Good morning. On behalf of the Ohio Department of Health Bureau of Maternal, Child, and Family Health, we are very excited to partner with Count the Kicks in providing today's webinar. Through our partnership, we're able to provide you with stillbirth prevention education and resources with a goal of decreasing Ohio stillbirth. Thank you for attending, and thank you for the work that you're doing to help Ohio moms and babies. I'll now turn it back over to Megan for today's presentation.
Awesome. Thanks, Melissa. And yes, we are so thankful to Ohio Department of Health. And like she said, due to our partnership, we are able to bring you this training for free. You are able to get all the Count the Kicks materials for free. We have a CE training we'll talk about in a little bit, and it's just an awesome partnership that we have with ODH. And I'm so happy to be here today to be talking to you about Count the Kicks. And so with that, I'm going to play a quick video. This is a video that aired on Good Morning America. And what I really like about this video is it does a good job of two things. One, quickly showing you what Count the Kicks is all about and how it saves babies. And two, what I want to do is show you after this aired, our app downloads and Count the Kicks blew up. It was like, went up like 37,000%. And what that really goes to show you is how much a story like this really impacts expectant women and the importance of those stories being told. So let's see if you can hear it.
We're going to turn now to that GMA parenting alert about a free app a mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble.
For Emily and Jeremy Ecoff and 2-year-old Liam,
oh, nice.
life with their new baby Ruby is extra precious.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did, and when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden, they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby.
Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
Great. So hopefully you heard that okay. I'll also put the link in the email that goes out. And so what I think that does is a really good job of really showing you just really quickly what the app looks like and how it works. Count the Kicks is truly a highly effective evidence-based stillbirth prevention campaign. We did not invent kick counting. That has been around. You all know this. But what we did do is what these founders did is we developed an early warning system for moms and the tools and resources for providers like you to talk to your expectant parents about on how to track their baby's movements and speak up if they notice a concern. In Iowa, the stillbirth rate has gone down around 32%. So we're saving 1 in 3 at-risk babies in Iowa, and that's what we want to bring to Ohio. And so how we do this is the exact same thing that we did in Iowa. We replicate the program, right? So we do these webinars, we remove cost barriers so you can get all the material for free. And then it's up to you all to be educating your expectant parents about the importance of this. And that's how we get to that 32% reduction. Again, our campaign is ready to go and low cost. So before I dive in too much further, I do want to make sure we're all on the same page with definitions and facts. I think we all are, especially with this group of individuals here, but just in case, I want to make sure that we all know a stillbirth is a loss of a baby after 20 weeks of pregnancy. It is further defined as early, late, or term. And you can see that breakdown there. And early is a fetal death occurring between 20 to 27 completed weeks. A late stillbirth occurs between 28 to 36 completed weeks, and term is between 37 or more. On average, we lose around 24,000 babies a year to stillbirth in the US. And then miscarriage is usually defined as loss of a baby before the 20th week of pregnancy. And infant mortality, which is the one that people often get confused with stillbirth, is the death of an infant before his or her first birthday. On average, we lose around 22,000 infants every year due to infant mortality. And the reason I really want to bring this up is to compare stillbirth and infant mortality. They are just as prevalent as each other. Stillbirth is just as prevalent as infant mortality, yet we tend not to talk about stillbirth. We understand it's a sad, dark subject, but we need to be talking about it just as much as we're talking about infant mortality, just as much as you're talking about the Back to Sleep campaign and not smoking around baby. All of those SIDS prevention efforts is exactly what we want to do with stillbirth, because you can see stillbirth is slightly higher than infant mortality. We need to be talking about this just as often as we're talking about infant mortality. And so I really want to bring your attention to this. So when you are talking to expectant parents, that we want to make sure, just from what we've learned from focus groups and things like that, expectant parents, we're not delicate flowers. We want to know this information. We want to know this education. And so I think it's important to really understand that it's just as prevalent as infant mortality. And then really briefly, some of the causes of stillbirth that this study cited below. These are some of the most common: pregnancy and labor complications, problems with the placenta, birth defects, infection, umbilical cord. That was Ruby's issue, medical complications with the mother. So just wanted to share that. And then before we dive in too much further, I think it's really important to understand the history and how we were founded behind the organization. So in the early 2000s, 5 Iowa women who you see on the screen there, they endured the heartache of losing daughters to stillbirth or infant death. And you can see their daughters' names written in sand there. They did not know each other at the time of their daughter's death. They actually got connected through pastors and friends and things like that. And so as they were grieving together and they were meeting and having conversations, they started realizing that, after talking, that stillbirth is a lot more prevalent than people think or let on. Even their doctors at the time were like, oh, this doesn't happen very often. But here's 5 Central Iowa women all within 30 miles that this happened to at the same time. And so what they started doing is their own research and figuring out that it's actually a lot more common than people think. It's 10 times more common than SIDS. 1 in 167 pregnancies ends in stillbirth. And so the very first thing they did is, in 2004, they worked with the Iowa legislature and they worked with U.S. Senator Tom Harkin at the time. He is one of the authors of the ADA Act. And they created Iowa's Stillbirth Registry. It is the most comprehensive stillbirth data collection program in the country. They received some CDC funding for the project. And after a couple others heard about that, they were asked to present about this project at a national stillbirth conference. So while some of the women were there presenting at this conference, they heard about a research study in Norway that demonstrated a 30% reduction in stillbirth by teaching pregnant women how to monitor fetal movement during the 3rd trimester of pregnancy by doing kick counts on a daily basis. And it's not just the Norway study. Several other scientific studies indicate kick counting, which is a daily record of baby's movement, so kicks, rolls, punches, jabs, during the 3rd trimester is an easy, free, and reliable way to monitor a baby's well-being in addition to regular prenatal visits. And so these women were thinking, oh my goodness, this is awesome. We need to bring this back to Iowa. And that's exactly what they did. So based on scientific research, the public awareness campaign that you all know, Count the Kicks, was actually created and born, if you will, in 2008. In 2009, they created Healthy Birthday. So they actually created the nonprofit Healthy Birthday after the campaign was created. They knew to get more grants and funding and things like that, they needed to be a 501c3. And so when they came back to Iowa, it was very much guerrilla tactics, where they worked with a local marketing company. They worked with Iowa Department of Public Health to create this evidence-based, mom-centered, empowered campaign. These women knew that what they wanted to do was truly create an empowering preventive campaign. They know, like you all know, stillbirth is hard to talk about. It's sad. They know better than anybody. But so what they wanted to do was create this bright, colorful empowerment campaign. And we'll talk about the material in a little bit. But one of my favorite stories is when you see this, and hopefully you've all seen the material, it's bright, it's colorful, it rhymes, it has a very Dr. Seuss-like feel. And so what they did is they went to Dr. Seuss's widow and said, hey, we are creating a stillbirth prevention campaign in Iowa, and we want to use your husband's, illustrations, that type of thing, colors. Are you okay with that? And she said, yes, we have it in writing. And I just love that story because I think it really shows how thoughtful and impactful what these women did to create this campaign. And so in 2013, they created the web-based Count the Kicks app, and very quickly soon after, in 2015, kind of when apps were kind of hitting the market hard, they created the mobile app, which you know today. It's gone through a couple of changes and things like that, and we're continually updating it. We hear from feedback and things like that, but we have an almost 5-star rating on each store. And so we're really proud of our Count the Kicks mobile app. And it wasn't until 2017 when the first executive director was hired. So we are a fairly young organization. We, from 2017 to 2020, we now have 5 staff. We have 4 full-time staff and a part-time staff. And so we have grown tremendously. We now have 11 states that partner with us and contract with us. The app has been downloaded in 141 countries. We have materials all over. And so we are growing wonderfully. And it's just a great organization to work for. We're obviously based in Iowa, but we have an actual international reach. And then 2018 was when we got the numbers of the 10 years. So in 2008, when Count the Kicks was created, to 2018, there has been a 32% reduction in the Iowa stillbirth rate. And public health officials have said, there really hasn't been anything else dramatic that happened in Iowa during that time. It's not like every pregnant woman got a doula. And in fact, risk factors have gone up. Obesity has gone up, smoking has gone up. And so we really feel like we have made a huge impact in Iowa with the stillbirth rate. And we want to keep going. We want to spread this around the world. And we want to put this in other states so that you too can have a lower stillbirth and save more babies. And so really quickly, national data, 1 in 160 pregnancies ends in stillbirth. The racial disparities are huge and alarming. Black moms, 1 in 94. Black women are 2 times more likely to experience a stillbirth over white women. Hispanic moms, it's 1 in 191. And then white women, it's 1 in 204. And then there's that shocking fact again, families are 10 times more likely to lose a baby to stillbirth than to SIDS. And so when we look at Ohio data, and this came from ODH, the 2018 rate for Ohio is 6.6 per 1,000. For white, non-Hispanic, it's 5.4. Hispanic, it's 5.2. Black, non-Hispanic, there it is, 11.2. In 2017, the rate was 9.7. So what can we do to really impact, especially the African-American rate? There's a couple different things, and I'll talk about what we're doing in Iowa, but some things that we're doing in Ohio is we're doing targeted social media. We're going to start doing targeted social media. We also focus on key areas of the state with higher rates of African-American, and then partnering with African-American organizations like First Year Cleveland. They're one of the first ones that truly implemented Count the Kicks into their area. I think Cradle for Cincinnati was in here. I know our ambassador has partnered with you before. It's just really about that education and making sure that we truly are working with other organizations, and that's what we're doing. A couple other resources that we wanted to share, and these will also be in your email, is the infant and fetal mortality link and infant mortality related programs. So if you're really interested in the data and you like that aspect and you want to know even county level, things like that, these are great resources for you. If you want to try and get in touch with more programs similar to you or find out what's in your county that's working on something like this, go to these websites or talk to Melissa, because Ohio has amazing, amazing resources, and they're doing an awesome job in helping lower the stillbirth rate. So really briefly, Iowa stillbirth rate, the 2018 Iowa stillbirth rate is actually 3.9 fetal deaths per 1,000, the lowest Iowa stillbirth rate on record. However, Iowa families still lose an average of 174 babies to stillbirth every year. And again, the racial disparities are alarming. It's the most dramatic between African American and white women, and that's across the board. So we still lose one baby for every 109 pregnant Black women, while for white women, it's 1 per 250. So why are there such large disparities in stillbirth? I don't think this will be surprising to anybody, but I think it's so important that we acknowledge this and talk about it. So researchers point to the following as causes for this disparity. So epigenetics, physiological variations that are caused by external or environmental factors, literally changes in the DNA from years and years of being treated unequally and or unfairly, essentially being an African-American woman in a systemically unjust society and all that comes with it have led to real and pervasive health issues for Black women. Predisposition to certain conditions that may lead to stillbirth, like gestational diabetes, high blood pressure, all linked to maternal stress. Experts say Black women are less likely than other races to receive early treatment for these conditions. Access to healthcare, socioeconomic barriers. Research shows education is not a determining factor. College-educated Black woman is still more likely to lose her baby than a high school educated white woman. So again, what can we do and what should we be doing? Count the Kicks. We're continually looking for funding opportunities to focus on racial disparities. We have a grant right now in Iowa that we have created an awesome campaign working with faith leaders in the community and beauty salons to educate them on the importance of talking to their community about the importance of fetal movement monitoring. And why we did that is because we actually did a focus group a couple of years ago with African American women to really hear from them and help plan and prioritize our outreach efforts. And what we found out was they get a lot of their information from a variety of sources, and it's not always their doctor or primary care physician. A lot of times it's their minister, it's their mom or grandma, so it's a generational, it's their hairstylist, it's their friends. And so we knew we really had to create information and outreach, meeting people where they are. And so that's why we created this faith-based toolkit, working with people very prevalent in the community. We are working with an African American pastor right now who is really helping us get in with several different churches in Iowa, creating different pieces. Because one other thing that we read or learned from this focus group is the Black women in this focus group were shocked by these facts about being 2 times more likely to experience a stillbirth. And they were upset, they were angry. They were saying, why doesn't anybody talk about this? Why is nobody sharing this with us? We are not delicate flowers, talk to us about this. So we are very factual. We put 1 in 92 out there, 2 times more likely. We need to give the facts. And so we also have the app in 12 languages. We have culturally appropriate material. First Year Cleveland, Cradle Cincinnati, blog posts. We have worked with all of you. We'd love to expand on those partnerships. And I know several of you are on today. If you have other outreach opportunities or ideas, feel free to let Melissa or I know. Like I said, we have 2 awesome ambassadors in Ohio that have worked with you guys in the past and that we can expand on. In this time of COVID, it's even easier to have these types of webinars and conversations and things like that. So those are just a couple of things I wanted to share. And then really quickly, I wanted to share, we have a lot of support and a lot of partners. And here is one video of Kimberly Noble Piper. She actually works at Ohio Department of Public Health. She has been with us since the very beginning. She's actually what used to be a labor and delivery nurse. So she has seen the side of stillbirth. And so now she's the Center for Congenital and Inherited Disorders at IDPH. And so I think she has a very moving video that I wanted to quickly share because, you know, we know stillbirth impacts the family dramatically. But it also impacts the medical team, the community. It's a holistic impact. And so here's her story.
Before I came to work at the health department, I was a labor and delivery nurse at one of the larger hospitals here in Iowa. So I know firsthand the impact that a stillbirth has on families, as well as the providers. And I have also seen the situations where the woman has monitored her baby's fetal movements and has come in because she's noticed a decrease in those movements and that baby has been saved. So I know that it works, and I know that Count the Kicks make a difference in saving the lives of babies. I think anyone that takes care of a pregnant woman should be teaching her about how to monitor her baby's fetal movements. There was one time when a family had a stillbirth delivery, and as I was dressing that baby after it was born, I realized that that little boy was never going to ride a bike, and that that little boy was never going to go to school, and that the parents would never be able to watch their son graduate from school. And even though you try to be professional and a little bit detached just to make it through your day, you can't help but be affected and know how important it is to prevent these stillbirths from happening.
So just a really short video. You can see she gets choked up, you know, about her experience with that. And I think what she says here, where she says, research shows that babies can be saved if expectant parents are educated about tracking their baby's movements and then reporting any change in baby's movement pattern to healthcare provider. What we really want to do is we want to educate expectant women and parents to understand what's normal for their baby. And that's what we're going to talk about here in a little bit when you implement the campaign. But I think what we're building up to is all this different research and evidence, because I really want to show that this is truly a research and evidence-based campaign. If you remember, I was talking about that Norway study in a couple slides ago that kind of spearheaded this entire program. This is the quote from that Norway study, and we have a whole website on our webpage on our website dedicated to research, because like I said, it's not just this Norway study. There's several other research studies out there that talk about the importance of tracking fetal movement. So again, Dr. Ruth Fretz, she's Harvard Medical School. She was one of the researchers on that Norway study. She also now sits on our medical advisory board, and she says tracking fetal movement is a non-invasive way for expectant parents to monitor their baby's health. Babies can be saved when expectant parents are educated on getting to know their baby's normal movement pattern starting at 28 weeks and to speak up if they notice a change. One of the things Dr. Ruth Fretz always says is an active baby is a healthy baby, because if you think about it, as adults or children, when we are sick, we don't like to move. We like to lay down, we just kind of lounge around, take it easy. And that's what happens with a baby who's in distress. Their movement starts to dwindle and decrease and things like that. And so I just like that quote, that kind of tagline, if you will, a healthy baby is an active baby. Like I said, we have a lot of different research out there, and we have several studies posted on our webpage. If you really are interested in research and like reading about it, absolutely go to our website and view it. Unfortunately, we don't have enough time to go through all of it at all today, but what I really wanted to point out is that there are a lot of studies out there that support this, and that the founders really did their research and background, and there's still studies happening. In fact, at Count the Kicks, we are doing a first of its kind study right now. It's almost finished. Between our Count the Kicks app and birth outcomes. And so what we're hypothesizing is that our app helps moms feel less anxious and bond with baby, and has truly helped prevent those stillbirths within those app users. And so that manuscript will be out later this year. It's being presented at APHA. And so we'll be sharing that as we move on, and we'll be sure to share it with Melissa when it's able to be announced and things like that. So be on the lookout for that. So probably what you're here for today is the implementation of Count the Kicks, and really what's this all leading up to? So again, Count the Kicks is that stillbirth prevention public health campaign. We didn't invent kick counting. We invented the tools and resources to help you educate your expectant parents on the importance of it. It's evidence-based, it's mom-focused. It educates women on the importance of tracking fetal movement. We have that mobile app, but we also have paper charts available for anybody that doesn't have a smartphone, doesn't have, or has internet issues, and things like that, excuse me. It empowers moms to speak up. We are all about empowerment, and that is one of the things I love about this campaign. And right there, you can see an image. It's bright, it's colorful, it rhymes, so you can really start to see that Dr. Seuss-like feel out of it. So when we talk about the app, as we're sitting here today, I hope you all pull out your phones right now, go to your app store, whether it's the iTunes store or the Google Play Store, search Count the Kicks, and you will see our bright yellow icon. If you have not downloaded the app, please download the app, like do it right now as I'm talking. And the reason for that is because I want you to use this app and practice with this app and become familiar with this app. So you are the expert when you talk to your expectant parents. You can pull out your phone and say, I downloaded it. This is how you use it. It's very easy. It's free. There are absolutely no ads. We are a nonprofit. We are here to educate and save babies. So there are no ads. It's available in 12 languages. We recently got it translated into Haitian Creole and Marshallese. We recently launched in Florida, and part of that launch, they said, we need this information in Haitian. And so that's what we did. And the reason I tell you this is if you work with a population that the language is not listed on here and you think, gosh, we need this information translated, please let us know. We are continually looking for grants. And like I said, we want to be culturally competent and make sure that we are meeting people where they're at. So like if you have a language or a group of individuals that really need this translated, let me know and I'll see what we can do. One of the benefits of this is moms can share kick session results on social media, or they can even send it via email to their provider. And so in a time of COVID, when unfortunately prenatal appointments are potentially getting stretched out or doing more virtual sessions and things like that, mom can go ahead and log into, if they have a portal. I know with my doctor, I have a specific portal that I can attach images to, or they can email it to their provider. And I'm not saying they need to do this absolutely every single time, but what I'm saying is make sure your moms know this so they feel empowered to say, hey, I am doing this and I noticed a change, or hey, I want you to talk to me about Count the Kicks, because it's also on the flip side. We want to educate moms to know they need to speak up to their providers if providers are not talking about this. Another great resource is we have push notifications. We have reminders on the app. We know that moms are busy and life is happening at a speed that is crazy. A lot of us are working from home with additional children home and just trying to manage a pandemic on top of everything else. And so we want to make sure moms never forget to count. So we have those push notifications. Moms can set up reminders to remind them, what time of day they want to be counting every day. And then you can count for singles or twins. You can see on this screen, this is a screenshot of what the app looks like if you're counting for twins. And so you just tap the little footprint every time you feel a movement. And then so you have Snicker and Doodle up there, and you would just switch over to Doodle when you feel movement with Doodle and type, like it's how it works for singles too. But again, download the app so you can become familiar with it. We also have a post-pregnancy survey. So after a mom's due date has passed, the app will send her a reminder and say, hey, just want to see if you've had your baby yet. If not, keep counting. If so, would you mind filling out this survey? It's just a couple questions. And what we're really trying to do is get a sense of how moms feel using the app and kind of what their birth outcome was. We have just implemented this less than a year ago, and we have had over, I think, 3,000 people fill out this survey. It's completely optional, but I can tell you about 99% of them have said, this makes me feel less anxious and has helped me bond with baby. We also asked the question, if they noticed reduced fetal movement, did they tell their provider, and then what were the next steps? So we're getting a lot of great information, and eventually we'll put that into this PowerPoint so you can see a little bit more of actual anecdotal feedback from the app users. So again, download the app. I hope you have all done that. We have, how many people on here? 89 people. So hopefully you all, 89, I should see 89 downloads in Ohio's reporting. But so what we do is, all you have to do is create an account, set up your pregnancy profile. Even if you're not pregnant, just go ahead and make up a due date a couple of months later and start messing around with it. You can do things like kick session history. You can read baby safe stories, set up their reminders. I just really want you to be comfortable with this. Add in your pregnancy details. I have about 24 pregnancies in there because I'm always messing around with it and testing it and things like that. So I really want you to do that. So again, you count for singles or twins. I can't stress this enough. What the app does is it lets moms know what's normal for their babies. Every baby is different. Every pregnancy is different. It might take my baby, I don't know, 15 minutes, let's say, to get to 10 movements. And it might take Melissa's baby 30 minutes to get to 10 movements. She knows 30 minutes is her normal for her baby. And I know 15 minutes is my normal. So let's say one day I'm counting and it's taking 45 minutes to an hour. I know that's different. That's not normal for my baby. And so I'm just going to call my provider and see what they want me to do. And then on the flip side, let's say Melissa's doing it for 30 minutes and she knows her baby starts getting movements and it's taking either really quickly, it took like 2 minutes and baby's almost frantic, or it's taking an hour to an hour and a half to 2 hours. She knows that's different. And so what we really want to stress to moms is, you know, what is that change? And the app starts showing the average time it takes to get to 10 kicks right away. Users will start to see a pattern or trend. I'm just going to go to this. So you can see this is what the graph looks like after a couple sessions. So it always shows 5 sessions, the 5 most recent, and it shows mom that line, you know, it's pretty consistent. It's taking this baby about 15 minutes to get to 10 movements. Now, if one day it took 45 minutes to an hour, that line would shoot up and that would kind of trigger mom to say, I should call my provider and see what's going on. So what's really great about that is moms don't have to think or remember and say, oh my goodness, I remember doing this with my firstborn. I'd be like, did it take him 10 minutes or is it because it's taking 20, 30 minutes or did it take him that long? I can't remember. And so we also have those paper charts that they can fill out, and that's on our website too if they don't have access to the app or anything like that. And then you can see, you can click on full history, you can click on share, and that's where moms can share it with their providers or their significant others. And then you have finished session, and once you click that, that will kind of complete that session and put that into the graph. So that's really the gist of it. It's super easy. You click on that start counting big red button, and it opens up this footprint right there that you see, and then you just click the little footprint and the timer starts, and you click until you get to 10, and that's it. So when we talk about Count the Kicks implementation, what we really want to know and what we really want to share is that we know and we understand talking about stillbirth is hard. It's not something anybody wants to do, but it's so important. I have had 3 children of my own, and not once was I ever told about any sort of stillbirth prevention. I was asked about, is my baby moving around 20 weeks? But that's not enough. Babies don't start getting that active pattern until around 25, 26 weeks. And so had I had a provider say, you know, this is just one thing you can do, it's non-invasive, that could help prevent preventable stillbirths, that would have made me stand up a little bit more and be like, what? Like, let's talk about this. I want to do this. So you don't want to scare moms. Pregnancy is full of risks that we talk to moms about. Stillbirth is another risk that moms deserve to be educated about. I remember going through all these early appointments, all these blood tests, learning about all these different things that might go wrong. And so why aren't we doing the same with stillbirth? We should be talking about it just like we're talking about all these other tests that are being done. Stillbirth just happens. There's nothing we can do. There can be warning signs if moms know what to look for. Reduced fetal movement is one of the first signs baby's in distress. Her baby's always active. It's not a concern. I usually say I don't hear this from providers very much, but I actually did just hear this from a mom who asked her provider if she should start counting, and her provider said, no, your baby's active, it's fine. And so what I would say to that is babies are active until they aren't. Cord and placental accidents can be sudden, and moms need to know what's normal so they can notice a change. So let's say your baby, and we hear this a lot from like when we used to be able to do baby fairs before COVID, but you know, moms will come up and be like, oh, my baby moves all the time. That's awesome because again, healthy babies are active babies. But what Count the Kicks does is really help mom say, okay, my active baby gets 10 movements in 5 minutes. And then the next day it's taking 30 to 40 minutes. That's a change. And that's something that we need to monitor and talk to our provider about. So it just gives moms that additional checkpoint for their babies. Plus, again, we're busy. So it's hard to remember, oh yeah, it takes my baby 7 minutes, or did it take 20 minutes? It just helps moms understand what's normal for their baby. She's almost at her due date. The risk of stillbirth actually increases as mom approaches or exceeds her due date. So a couple other misconceptions, again, that babies move less the closer to their due date. Babies do not move less, they might move differently. You may feel less sharp kicking and more rolling. However, if mom is monitoring the baby's movements at the same time each day, it should still take about the same amount of time to feel 10 movements. Many of you who are probably home visitors or anybody working with first-time moms, I feel like you might get this question a lot about, what should the movement feel like? And movements just, like I said, you might feel less of that sharp kicking and more of that more rolling type of movement, but they should still feel movements. Hiccups do not count towards a movement because those are involuntary. So that's another question we get a lot. Here's the active one again that we just talked about. Again, tracking your baby's movement every day takes the guesswork out of knowing what's normal for your baby. Here's a big one. I can hear baby's heartbeat on the Doppler device, so I don't need to worry about movement. Hopefully, we really recommend, unless you are medically trained to use a Doppler, that nobody should be using it. And so a change of baby's heartbeat is one of the last things to occur when a baby is in distress, whereas decreased movement is an early sign. And another thing with this is we have heard lost stories where they were using a Doppler device and they thought they heard the heartbeat, but it was their own heartbeat. So again, unless you're medically trained, we really don't want moms using a Doppler device. Here's an old wives' tale, but this kind of goes back to, I heard this from my grandma. Oh, you're probably, baby's running out of room, not moving as much. Baby should continue to move up to and during birth. And so when we think back to those focus group with those African-American women where they might get a lot of their information from their grandmas or great-grandparents and things like that, that could be something to be aware of to make sure that they're getting that health information that's up to date. Here's one that usually surprises people. Mom should get 10 kicks in 2 hours. This is actually a common misconception and now outdated information. What research now states is that moms should be focusing on fetal movement in general and understanding their baby's pattern. If you're interested in this, I don't have time to go into it today, but we do have a research study about this 10 and 2 that I would really highly suggest you read, because I think the important thing is, if you think back, what we want to do is we want to teach moms to understand what's normal for their baby. We don't want to put that time constraint on it, because what happens and what this research study showed was a mom who normally gets her 10 movements in 15 minutes, let's say she got it in 2 hours and she's like, great, I made it in 2 hours. That's awesome. I did it. But normally she gets it in 15 minutes. So that's a long time. That's a big difference and not normal for her baby. And so we just want to normalize and make sure moms know they need to know what's normal for their baby. So go ahead and check out that research study on our website. So how do you talk about Count the Kicks and how do you bring this into your program, whether you are an OB, you're a nurse, you're a frontline worker, you're a home visitor? There's very similar ways of how you're going to be doing this. At 26 weeks, if high risk, or 28 weeks otherwise, that's when you should start talking about Count the Kicks and fetal movement monitoring. If you do childbirth ed classes or anything like that, we have awesome resources on our website. We have lesson plans for you. So go on there and check it out. Here are some questions. You want to use sort of motivational interviewing techniques, those open-ended questions. Let's talk about how to track your baby's movements. Share how movements are jabs, rolls, pushes, anything but hiccups. Ask if they have questions about it. Share the brochure. Pull out your phone and show them the app. A great time to do this is when they're doing their glucose test in the office and say, here's your drink. Drink it. Once you sit down, go ahead and download this app. Give them an app card that you should order on our website for free, and have them downloaded it. And then when they go into their 10, 15-minute appointment with their midwife or doctor, you can talk to them about it, or the nurse can talk to them about it and say, hey, did you download the app while you were sitting out there? Do you have any questions? Let's go through how to do it together. And then ask about it at every single appointment. Again, stress the importance of knowing their baby's normal and speaking up if there's a change. Here's a big one. Make sure mom knows what number to call if she has a concern. We have heard from providers time and time again, and I think you would all relate to this, is you want to know if something's off, whether it's reduced fetal movement or bleeding or discharge or anything. Moms need to feel comfortable calling you, whether it's 2 a.m. or it's 7 a.m. And so make sure mom, there's usually an after hours number or a nurse on call. Make sure she writes that down or has that information readily available. If you are a home visitor or you work with moms that way, make sure you know, and so she can put it in her phone and work with mom to make sure she knows her number to call. Send a brochure home with mom and our app card. You should be putting up our posters in restrooms where they give their urine sample. If you have different entry points now because of COVID, let's say they're coming in the back door or something like that, make sure you put the poster up there. If they're going straight to the ultrasound room, make sure you put a poster in there. I think with COVID, we need to kind of pivot a little bit of what we normally would do and add these additional places. Share with mom that research shows evening is usually the best time to count babies' movements. I don't get too hung up on that because, you know, if you have people that work third shift and things like that, we don't want to alarm them and say, oh my gosh, I'll never be able to do that. They really just need to pick a time baby's most active and keep it the same time or roughly the same time every day. So some things you can say, tell me about your baby's movement. How is tracking your baby's movement going? Can you show me your Count the Kicks graph? And what questions do you have? For those that maybe like home visitors, if, you know, really stress to them that you should be telling them to their moms that they can talk to their providers about this. Say, hey, has your provider talked about this? If not, show them your graph and have them bring it up at an appointment. And so really encourage mom to tell a provider. It's all about that empowerment. And then what about talking to moms who have had a stillbirth previously about fetal movement? And so what we did is we asked a lot of our ambassadors who are lost moms and got some feedback on what they wish they would have, you know, when they had rainbow babies or things like that. So really, it's the same thing. Follow the same protocol. Since women who have had stillbirth are more likely to experience another stillbirth, talk about starting to track babies' movements around 26 weeks versus 28 weeks. If you were not their previous provider or you see them after the stillbirth, acknowledge her child. Ask about the name, the gender. Stay away from medical terms like fetal demise. Be empathetic. Ask if anyone has talked about the importance of tracking fetal movement before. A lot of moms we talked to that have had previous live births stated they were never told about the importance of tracking fetal movement. We found out about, there's a woman in Pennsylvania who has 2 children, 2 girls. She was pregnant with her 3rd, and she was, I think, a week before her due date. And she mentions now she noticed reduced fetal movement, but she didn't think anything of it. And she went in for her induction and she had lost the baby, it was stillborn. And so what these moms do is, you know, they have no idea what happened, what went wrong. And she said, you know, I've had 2 children and nobody once told me I should be tracking fetal movement. And I know when my baby, you know, I have a significant difference of when baby kind of stopped moving or the movements got a lot lighter. I mean, it's just devastating. It's devastating. There's no reason why we can't be talking about fetal movement with expectant parents. One amazing thing that Ohio is doing is they're implementing the SOARS project. And that is the study of associated risk of stillbirth. It's a statewide population-based survey designed to collect information on maternal experiences and behaviors before, during, and after pregnancy among women who experienced a stillbirth in Ohio. This is critical time population-based data to better understand the risks of stillbirth. I think there's maybe, I know Utah's doing this and North Dakota's trying to implement this. So Ohio is one of the very few doing this. And this is going to be amazing data that we can use across the board. This is so fantastic. And the reason I tell you this today is because We really want you to help spread the word. If you're a provider, you should get this information. I will send it to you in an email because there's a flyer about it so that you know what to do if unfortunately there is a mom that you are a doctor and there is a stillbirth. And so I just wanted to share this with you all, that Ohio is doing this amazing thing, and hope that you can help share this message. So this will be in your email. So again, implementation of Count the Kicks into different settings, whether you're OB, midwife, home visitor, FEMUR, childbirth educators, it's all roughly the same. You want to become familiar with Count the Kicks. You want to download the app, order the materials. I hope to see tons of orders come into my inbox when you go online and order materials today. It's just amazing when I do these webinars, the orders just go through the roof, because you just need to get that in stock, and I'll show you how to get those orders here in just a minute. Review all of our material on our website. Make sure your entire team knows about the campaign. Your front staff who are checking people in and out should know about this. They should say, hey, grab this card. Your nurses should know about this. Every single person you work with or in your building should know about this. Integrate into care plans and touch points. This is especially important for home visitors. You can ask specific questions and put in kind of talking points to talk to your moms about this. If you are a provider and you want to include this in your EHR, awesome, talk to me. That would be my dream, to get this into EHR records where it just pops up at 26 or 28 weeks to say, hey, talk about fetal movement monitoring with your mom. And so it's very the same. Labor and delivery triage. I think we do have some labor and delivery nurses, and I think it's really, really important to just touch on this and really ask yourself, what's your current protocol when someone presents with reduced fetal movement? Is the entire staff trained on how to handle an expectant mother who calls or comes in with reduced fetal movement? What's on the discharge papers? If mom comes in with reduced fetal movement, you do all the medical tests, the NST, the biophysical that you're supposed to do, and everything looks great and everything's fine. What's on the discharge papers? Every mom that comes in is sent home with literature after her test. So make sure that you're adding Count the Kicks information. Mercy in Iowa does an awesome job of this. They have a labor and delivery ER, and they have all this information on their discharge papers. And then make sure mom knows who to contact if there's other issues or anything like that. So again, we have a couple slides, so I'm speeding up a little bit so I can get you out hopefully on time and leave time for questions. But stress the parents to trust their instinct. If mom is feeling concerned or something isn't right, call the doctor. If you're working with families or generational families that live together, make sure that, if mom says, I don't feel right, I feel like something's off, they should support her. They shouldn't say, oh, maybe just wait a couple of hours. She should call her doctor. Trust her instincts. Share that sleeping lying on their left side is best for them and baby. Whether left or right is completely fine. If they wake up on their back, they just turn to their side. Review those common myths. Discuss a plan of action if mom noticed reduced fetal movement, especially if you're working in rural areas. Because if your mom has a 60-minute drive and she's noticing reduced fetal movement, she needs to get going to the hospital or call her provider. So just some things to think about. I'd be remiss if I didn't talk about COVID-19. We have created a lot of great resources during this pandemic. We have Count the Kicks academies for patients and providers, basically a suite of resources to navigate a time where in-person interaction between patient and provider is less frequent. If you're having a lot of phone calls, Zooms, we have a lot of factual evidence-based information on COVID-19 and pregnancy on our website. And then these Count the Kicks academies for providers. It has everything you need in one place to share this information with your moms. It has baby safe stories, everything like that. And so go to our website, check it out. Here's how you order material. It's all free for you, thanks in partnership to ODH. So you have this promo poster that you see here that comes in English and Spanish. You have a how-to poster in English and Spanish. You have app card reminders, and you have brochures, all in English and Spanish. All you do is you go to counttthekicks.org. On the top of the screen, there's a click on order materials. It will open up a picture of the United States. Click on Ohio, fill your shopping cart, and that is it. And like I said, I hope that we see tons of orders come in after this, because this is completely free. This removes a barrier. ODH partnership removes this barrier for you as providers to be able to order this for free. It's amazing. And this material is bright, it's colorful, it's empowering, it's easy to understand and easy to implement. It's easy to put up. There's no reason why. One other thing that we have done with ODH is we have been offering these CE trainings. This is an online module. So it's very similar to what we're doing today. It's just you can potentially get 1.5 CEs. If you use the code SAVEBABIES-OH at checkout, it should knock it down to free. There's a limited amount of coupons available, but if you go to that website, you can download it. You have 30 days to finish the course. It should not take you 30 days. It takes about 90 minutes. It goes into the research a little bit more. It's a little bit more interactive, but it doesn't have that Ohio specific data and feel like this does. But again, you could potentially get 1.5 CEs. And again, with a partnership with ODH, we're giving this to you for free. Okay, I want to turn it over quickly to Carrie Davis. If Carrie's on, give me 1 second to check. Carrie Davis is one of our Ohio ambassadors. She has been with us for several years. She is a fantastic woman, and I have asked her to share a little bit more about our ambassador program and her story. Hi, Carrie.
Hi, Megan. How are you?
I'm great.
Are you able to hear me? Okay.
I can hear you. Yep. I'll just go to the next slide.
Okay. Well, thanks everybody for being on this webinar today. My name's Carrie. As Megan said, I'm one of the Ohio ambassadors for Count the Kicks. My journey to being an ambassador started in 2013 when my daughter Harper was born still, and it was on March 5th of 2013. It happened 3 days before her due date, and I'll never forget those words. I'm sorry, her heart isn't beating. Stillbirth is absolutely devastating, and it's been my goal as a Count the Kicks ambassador over the last 7 years to make sure Ohio moms are getting this information about how important it is to do kick counts. As a mom who experienced a stillbirth and 2 subsequent successful pregnancies, I can tell you firsthand what an empowering and positive experience this can be for moms. I know this is going to save a lot of lives here in Ohio, and we're going to see the same positive results as they have in Iowa. And it all starts with you giving moms this information. You guys are the key. So I thank you for what you're doing and your willingness to learn about this, because it's so important. Thank you.
Great. Thanks, Carrie, for sharing that story about Harper. And here are some images that Carrie has allowed us to share. And then our other ambassador, DeShonda, right there on your screen. She had a baby, Aubrey, born sleeping on June 3rd. And their contact information is here. And our ambassadors are amazing, amazing women. A lot of them are lost moms. Some are baby save moms. Some are just really passionate about this program. But what they do, especially Carrie and DeShonda, is they are your boots on the ground. They have lived this, and they can help have webinars and share this information in a time where pre-COVID, you know, Carrie has gone, I know, and done presentations for us. Because we're based in Iowa, these women are so impactful and important to our work, and we just value them tremendously. So some things that ambassadors can do, they're the volunteers. They can do baby fairs, give media interviews. They work to help grow partnerships. They do so much for us. And we have over 34 in all of these states here in yellow. It has been truly amazing and wonderful to see these women come together and work for such a wonderful cause and to share their stories. You can see Aubrey again, and DeShonda, she just had her rainbow baby this year. And so she is very busy teaching and things like that, so she couldn't join us today, but she also is available for various, you know, presentations and webinars and things like that. And then again, Carrie's been with us for several years, and I've gotten to know Carrie over my year here, and it's been fantastic. And just what they're doing in honor of Aubrey and Harper are amazing, and we thank them tremendously. So again, I'm so close to 9 or 10 your time, so download the app. Practice, practice, practice. Make sure you share the information with the team, order the material, and take the online CE training. There's a lot of different ways you can connect with us. We have Facebook, Instagram, Twitter, our website. Sign up for our newsletter. We want to hear from you. My contact information is on this last slide coming up, but I really want to get to this. This is what Carrie was talking about. Carrie and Deshauna, you guys helped do this. This is Ohio Baby Save we just found out about. Meet Magdalena. This is what Magdalena's mom says. One day of not counting can mean the difference when saving your baby's life. It is so important to count those kicks. I thank God for Magdalena, my little miracle baby. From ODH, Count the Kicks is a powerful tool in helping mothers evaluate and track their baby's movement. Mothers are in a unique position to feel changes in their pregnancy, and Count the Kicks empowers them with a method to better track and document these changes for health experts who may be able to help. We are so excited to know that these resources were able to help save a life and hope they save many more. And these are just the stories we know about. We know there's stories out there. Magdalena was shared on social media. It blew through the roof through Ohio social media when we boosted it and things like that, because those baby safe stories and those stories of loss and change and things like that are really meaningful and impactful. So I just wanted to share this of Magdalena, a cute little baby that was saved by her mom using Count the Kicks. So let's save babies together. I am so excited you are here today. My contact information is there. I'll go back to the very first slide, a couple slides where you saw Melissa's contact, you saw Carrie's contact, and mine. We would love to hear from you all. We are here to answer questions. We are here to help you implement this. It is at exactly 10 o'clock your time, but I will be staying on for any additional questions you may have. There we go. Let me see. Let me check the chat really quick. Okay. So if you have questions, go ahead and either raise your hand or put in the chat box and I can unmute you, or you can try and chat it. I'm just looking through to make sure we didn't miss anything. Let's see. Paula, I've heard of it for a while, but never got to do the training. I never thought I'd be using it myself, considering I'm 38, 15-year-old and 12-year-old. Great. We'd love to collaborate in Columbus. Okay, great. We'll celebrate one. Okay, awesome. Any questions for me or Melissa or Carrie? We are here for you. If not, thank you, thank you, thank you. Thank you to Melissa and her team at ODH. Thank you for Carrie for always being willing to share your wonderful story and impact that Harper is having on this world and in Ohio. Feel free to contact us. With that, you will get an email with all this great information, and I will stay on for a little bit longer if you do have questions. Otherwise, feel free to sign off, and thank you for helping save babies with us. I'm going to stop recording.